Hello, everyone, and good afternoon. We're in the home stretch. We have almost made it. We've heard so many amazing talks today. My name is Kiera Nichols. I'm a contractor with the Policy Center. I also work for a few other nonprofit organizations, one called Soul Tribe Heals, where I help bridge the gap between indigenous healing practices and westernized healing. But it's really great to be here. Our next panel is going to be discussing parental needs and supports, moderated by Marcy Miller. Marcy is a senior program officer at Perigee Fund, where she focuses on systems change across the prenatal to 3 mental health field. As you know, Perigee has been making a big impact in maternal mental health, honored as the 2025 Maternal Mental Health Hero. Today, Marcy will moderate the conversation with an esteemed panel to discuss critical supports parents are in need of. Welcome back to the stage, Marcy.
All right, there we're on. Thank you, and thank you so much. So we have examined the data. We've looked at gaps at maternal health, funding and policies that are potential policies. We looked at innovations, the need for culturally congruent care, and also just some beautiful stories from the heart. So today, and postpartum care and beautiful stories from the heart. But today we wanted to really think about, talk to you a little bit more about, unpack what types of supports are not only helpful for women to recover from maternal and mental health disorders, but what might mitigate them. What are the supports, those holistic supports needed after for care? So I'm going to have my panel go ahead. This esteemed group of ladies go ahead and tell their name, their agency, where they work, and just a short statement about your work.
Great, thank you. My name is Tegan Lecheler. I am the National Program Director at the Bridge Project, which is a guaranteed income program for low-income pregnant folks in the perinatal period. So beginning in the second trimester and then all the way up until the baby's just under 3 years old, we give low-income women just straight up cash, direct cash. They're paid 2 times a month. It is completely unconditional, no strings attached, no questions asked. They don't have to participate in anything. They don't have to, answer any questions, do any screening, attend any classes. It's literally just cash. And we do research on the side also to understand the way that this impacts, the infant health, maternal health, mental health, accessing healthcare, all these different things. And I'm sure no one is surprised that it improves literally every outcome when you have a higher income. So that is Bridge.
That is great. Okay, Heather.
Hello, everyone. I'm Heather Sandstrom. I'm a senior fellow at the Urban Institute, which is an economic and social policy research organization here in Washington, D.C. I lead a team of about 25 dedicated researchers studying issues of childcare, early education, and parenting support programs.
Wonderful.
Hi, everybody. I'm Cindy Herrick. I'm with the Policy Center for Maternal Mental Health. I serve as their senior research and editorial manager. So I oversee all of our issue briefs and our fact sheets. I also do research and head up our maternal suicide research.
Great.
Hi, everyone. I'm Abby Lane. I'm the policy director at the Prenatal to 3 Policy Impact Center out of Vanderbilt University. And our center is a nonpartisan research center that aims to accelerate states' equitable implementation of effective policies that can help all children thrive from the start. Our work covers a broad range of policy areas in the prenatal to 3 period. Although I'm going to focus on paid family leave today, we cover a lot more. And we really focus our work and how we approach our work by thinking about how state policy choices can empower parents and support children's healthy development. We believe that systems of support that are really comprehensive during this period require both broad-based economic and family supports, as well as targeted interventions to help families, that we need to care for caregivers so that they can care for children, and that the variation that we see in state policy choices leads to a patchwork of supports for families. So excited to be here today.
Thank you. All right, Emily.
Hi, I'm Emily Rosenberg, the Senior Director at Center Road Solutions. We champions the cause of nonprofits that serve women and children, but I am on this panel with my hat as Membership Director of the National Family Resource Center Coalition. Our coalition is dedicated to expanding and strengthening federal funding for family resource centers across the country. We are made up of individual FRCs, network chapters, and allied organizations supportive of family resource centers.
Thank you. All right, Tegan, I'm really excited to hear more about the basic income for mothers. Who's championing it and why?
Yeah, so we, as you can imagine, there are all different industries and all different folks who are really excited about this work. We work with a lot of healthcare practitioners, so a lot of folks in pediatrics, a lot of doctors themselves who are saying, this allows us to just do our job when we don't have to, send people home and tell them you need to be eating 3 meals a day, right? Instead, we can be focusing on actually providing healthcare. And then also we work with a lot of researchers and a lot of policy experts. I think when folks hear about direct cash programs, often the assumption is that they are really, really expensive and that this is never something we'd be able to scale or never something that would be able to be publicly adopted. But actually what we're seeing is that we save a ton of money on the back end when we invest up front. We see higher birth weights, we see fewer preterm births, we see significantly less postpartum depression in our moms who are receiving direct cash. And all of this amounts to so much savings that there are economists on both sides of the political spectrum. There are researchers on both sides of the spectrum who are actually really excited about our ability to not only improve maternal and infant health outcomes, but save money while doing it.
Thank you. No, this is such exciting work, and I know Perigee's really excited about it as well in our own strategic plan. So it's great. Heather, can you tell us about the DC Childcare Research Partnership and some of the early findings from your research with parents?
Great, thank you. So yes, I am a researcher, so I'll be kind of getting in the weeds of some of the research projects that I've been conducting, and so I'll rely on my notes a little bit to make sure I get some of the statistics and quotes right. But yes, since 2019, my research team has been collaborating with the District of Columbia, specifically their Office of the State Superintendent of Education, Division of Early Learning, which administers their child care subsidy program, as well as quality improvement efforts. And we came together under this collaboration with federal funding from the Administration for Children and Families, originally to study issues of childcare supply and quality as the district was rolling out a new quality rating and improvement system, specifically an initiative to try to help childcare programs kind of set and achieve quality improvement goals. So when we kicked off the project, all was going well, and then the pandemic hit in 2020, and we had to pivot a bit to kind of think about kind of the landscape of childcare as we were seeing lots of staff turnover, program closures, families having issues trying to find childcare. So we kind of pivoted in our research and said, all right, well, what is important now? What are the key priorities for our research project? And so we said, well, let's really kind of, we had one study component that was focusing on the workforce and well-being, but another to really focus on parents and parents' experiences, and really wanted to understand what is it like during this post-pandemic period to try to find childcare. So we did lots of data collection, a survey, followed focus groups with parents, and again and again, we were just seeing common themes that were not just related to the pandemic or post-pandemic, but these are things that we've been seeing in our research all along, but were just really exacerbated by the pandemic, but just issues of childcare supply, waiting lists, not being able to find a childcare slot for that particular child's age, not being able to afford care, not knowing where to find information, and just lots of barriers and challenges. And I think for me that I was particularly struck by the comments that I was hearing from first-time parents, especially the first-time moms that we were interviewing that were just kind of lost in this process and said, I just wish I knew earlier. I just wish I had someone tell me what this experience would be like, and just the importance of information. And, I think for those who did have an easier experience, because not everybody, had challenges. Some people said, I found childcare just fine. But looking at the difference between those that had that hard experience and those that had an easier experience, it was really about having information, having that social network, connections to people in the community, whether it's your friend, your neighbor, relatives nearby, employers, coworkers, just somebody to share that kind of information. And, it was just, they raised lots of questions about, do you know about childcare programs nearby? Do you know about childcare subsidies? Do you know how to apply for a subsidy? Do you know what a subsidy even is? That you can get like a voucher to help pay for care if you're income eligible? Do you know what quality looks like? The fact that there is a quality rating system, like what is that? What does that mean? Is, what does good quality look like? And just the kind of the steps in the process. And one mom had shared, how just overwhelming and stressful the situation was for her. And she said, I found that it was a nightmare when I was first trying to find anything. I had applied to a daycare center when I was 3 months pregnant. After she was born, I was scrambling to find a place and was throwing money around on deposits, finding out that waiting lists are not real. It took a long time and was both stressful and expensive. And then so after that project, I decided, I really was interested in this topic of new parents and just kind of this transition to parenthood and just beyond childcare being an issue, but just like, what is this like for new parents kind of navigating this space? So among other things, we did in-depth interviews with 30 first-time parents of infants, sat down face-to-face, one-on-one with them and just said, share your experience. Tell me what it was like transitioning to parenthood. What was it like kind of balancing work and childcare? What was it like returning back to work? What was it like looking for childcare? What were you looking for? What were your priorities? And it was just enlightening. I mean, I've been in the research field for 17 years, have done tons of surveys and interviews, but I would say that small sample was probably one of the most enlightening. We had people from all different backgrounds, different parts of DC, higher income, lower income, different racial, ethnic, linguistic backgrounds, and just the common stories that they shared about this is hard. This is really hard. And I really wish I had somebody to help me. And just, again, this information issue that, just wanting to have more timely information. And I can just remember this story the one mother told me about, when I left my birth hospital, they gave me so much paperwork. I had information on breastfeeding and SIDS and how to get the birth certificate and this and that. She's like, nobody told me about childcare. Yeah. Nobody said, you should be thinking about childcare. Do you realize that there's a waiting list, over 12 months for childcare in the district? And it's not just the district, it's, other places in the country as well. Just families again and again, just not really knowing what their options are and not knowing where to start. And if you're not connected, you can't wait until you need care. It's not that you're going to go back to work next week and all of a sudden you need to find an arrangement.
It's so important. And thank you for highlighting that. I mean, that clearly impacts maternal health, your mental well-being, and the care after. So thank you so much. Cindy, the Policy Center released a new report on paid leave last week, which is so exciting. Both reports are on the app. And what are the 3 to 4 most important things we know about the link to paid leave and maternal mental health?
Thank you so much. Just to sort of piggyback on childcare, this is the third in our series of issue briefs that really focus on holistic care for maternal mental health. The other 2 is on childcare and childcare deserts, and the other one is on diaper need. So this third one, we were very excited to touch upon paid leave, and it should be no surprise to anybody in this room that there is a significant link between paid leave and maternal mental health. Research has shown that with paid leave, with each week of paid leave that a mother has, the odds of her developing postpartum depression goes down. And consequently, in studies where they have studied moms without paid leave, the risk and the odds of postpartum depression and anxiety and other maternal mental health disorders go up. Absolutely. No surprise there for a variety of reasons. And the second point of that is that, to piggyback on my first point, is that the financial strain that is on families, especially new families, first-time parents, and the heartbreaking choice that they have to make between supporting themselves financially and their physical and emotional well-being is real. And it's absolutely heartbreaking that they are faced with this struggle all the time. I think a common theme throughout yesterday and today is things are being siloed, and we want to break down those silos. And the other thing is to how to holistically support moms. And I think this paid leave issue brief and beyond that shows that beyond great treatments, beyond access, you can have all of this, but if you don't have basic rest and the time to feel secure financially to take that rest, then you can't maximize all of these things, even if you have access to it, to really amplify the effects of that to help mom heal.
Thank you so much. And that you're absolutely right. That holistic look is so critical. Thank you. Abby, so since little progress has been made to address paid leave at the national level, some states are passing laws to provide paid leave. What does this look like in the states that have the strongest programs for young children?
Thanks, Marcy. So states have really taken the lead in enacting and implementing statewide paid family medical leave programs, and there probably isn't going to be a lot of federal action on this in the near future. So this is our opportunity, and I am going to focus a lot of what I am sharing about paid family leave specific for that period where you're bonding with a new child, for parents who give birth and those who don't, because this is really where the research is to date so far. I'm also a researcher, so care a lot about that. And want to add to what Cindy was saying too, is in addition to improving maternal mental health, paid family leave programs are actually shown to positively impact a broad range of outcomes. So that's a really important point to keep in mind too. It's not super surprising to probably a lot of folks in this room, but is important. So when we first started our work as a center 5 years ago or so, only 6 states had statewide paid family and medical leave programs. Since then, 4 new states have implemented programs. There are states that have made their programs more generous by increasing the amount of time that families can access leave, or the amount of wage replacement benefits they're able to get while they're on leave. And then we've also seen 4 states enact programs that will become effective in future years, hopefully all next year, depending on what happens this session. We've also seen a lot of legislative and administrative action in this area. Several other states have come very close to passing legislation, both this most recent session and the current session as well. And then we've seen a lot of states taking steps where they're implementing programs for state employees. We don't have evidence about whether this is a good stepping stone to statewide programs that we know are effective, but it's something that happens, and hopefully we'll find out good things from that too. So I am not going to pick a state that I would label as having the strongest program, because there are a lot of policy design decisions that shape how these programs are experienced. And so I'm going to list a lot of those policy considerations for you. That states should really think about these decisions together and how those impact the families who are paying into this program and then receiving benefits. So first, of course, the big thing folks think about is how long is that leave? Most states are providing 12 weeks of bonding leave or moving in that direction, not all of them. And some of those parents can also access medical leave benefits if they were the parent who gave birth on top of that. And then also thinking about how and whether there's flexibility in the taking of that leave. So you have to take it in one big piece. Can you break it up? Can it be split throughout the week if you need to, if you don't have childcare full time yet, for example? It's not very common, but is the thing. And then thinking also about what percentage of workers' wages are being replaced while they're on leave. Is it important that everyone's wages are replaced at the same level, or does a state want to replace wages for lower earners at a higher rate, or those first part of your earnings at a higher rate, which is of course very important for equity, and thinking about the accessibility of leave, because if you're only getting 60% of your wages, but you're earning just above the minimum wage, that leave isn't really accessible, and certainly not for the full duration of that time, because all of the money is going to pay for basic needs. States also have maximum benefits, so that's important to think about as well. And then thinking about eligibility, the sectors that are covered, who automatically is opted into the program versus who has to do so on their own, whether there's restrictions around employer size or work hours and tenure requirements. And then also whether leave is job protected. The FMLA covers many workers, but not all workers. So states can and have taken action to provide some job protections to fill gaps in coverage there as well. And then also thinking about who pays in. One of the biggest misconceptions we've found is that folks don't realize that paid family medical leave programs are really insurance programs, right? Workers are paying into these programs who then receive benefits back. Very similar to how someone can pay a health insurance premium and then they have a benefit back. So thinking about who is paying and how much are they paying, and knowing also that this is a really small portion of your payroll that is being paid into it, but that matters. And not all insurance programs are created equal. So thinking about these design decisions together, I do wish I could really tell you how each of these decisions are impactful and improving outcomes, but the research isn't there yet. So as more states have begun to implement these programs, we're really hoping to learn, what is the optimal duration of leave? What do we need to know about how to replace wages and who's eligible that really maximize the benefits that we know are so important in this period?
Great, Abby. That's so helpful. And I really appreciate you listing out those considerations. So thank you. Emily, so I'm really excited to hear more about the history of the Family Resource Centers, how many there are, and the range of services that they really provide for families.
Yeah. So family resource centers, they emerged in the 1970s, 1980s, really to support families, prevent unnecessary child welfare involvement, and provide parenting support and support groups. They really started gaining national attention in the 1990s, and states started taking advantage of federal funding under Title IV-B, which is a key child welfare federal funding. Today, there are over 3,000 FRCs, Family Resource Centers, across 39 states and the District of Columbia. And they provide a range of services. What is really unique and special about Family Resource Centers is they are tailored to the community needs and what each community needs. So they provide mental health counseling, including care for maternal health, parenting classes, support groups, financial assistance, connections to medical, legal, housing resources. And really, FRCs they're a lifeline for parents and families, offering essential support, resources, and empowering families, navigating challenges with them, and walking alongside them to build strong and healthy families.
That's great. It's really great to hear about those resources. So it's clear there are ways in which we can support people after birth and how important that really is in a holistic fashion. So I'd love for each one of you just to share what is the top barrier for scaling your proposed solution and any potential opportunities that you see? Just go down the line, Tegan.
Okay,
what do you
great.
think? Go for it, Tegan. Thank you.
Yeah, so currently Bridge operates across 7 states. We're growing very rapidly. We're coming to Boston next, actually. So Massachusetts folks, we should connect. But I will say we start out entirely privately funded. And then once public entities start to see the success, they start to, hear about our models, see all the savings on the back end. Then we get public funds invested. And we currently have received public funding both in New York and Wisconsin. And as we are, continuing to scale and establish programs across the country, we are working to eventually have a direct cash program at the federal level for moms who are giving birth on Medicaid, right? That is the ultimate goal. And under the Biden administration, we're making a lot of progress working with the Maternal Child Health Bureau, working with CMS, working with all these folks to think about how do we receive an 1115 waiver to try out a program like this and have it, be funded through Medicaid dollars. But there's a lot of red tape and there's a lot of confusion. It's kind of a gray area if Medicaid dollars can actually go straight to a person. Folks were kind of unsure. Maybe it has to go to the housing provider or to the medical provider. It can't go right to the recipient, right? And so a lot of the I don't knows and that's a bit of a gray areas really slowed us down. And now that won't be happening for about 4 years, probably, when we will see any progress in there. So I would say just what we need to continue scaling is for folks to, not let the I don't knows or the gray areas slow you down, to take some bold risks for the greater good, to say, I don't know, and let's find out by giving it a shot. Because I think we could have made a lot more progress if someone had been willing to say, I don't know, but let's give it a shot.
Thank you for that reflection. That's super helpful. How about you,
Heather.
Or Heather, sorry.
That's okay. I mean, there's so much to say, but I think, in the child care field, we really just talk about the issue of access. And access is really defined as with reasonable effort, that families can find childcare that they can afford, that supports their children's development and meets parents' needs. It really needs those 4 dimensions. And I think, we just have a childcare crisis in our country right now where 1 in 2 kids, U.S. kids, are living in a childcare desert where there's actually no licensed childcare provider in their zip code, or they don't have enough slots to go around to meet the need. So, I mean, it's a supply issue, it's a cost issue. Parents can't pay more than they already are. And so it's going to take investment and innovation, because there's only so much that we can do in terms of on the investment side. There's a lot of innovation happening in the field. And I think in terms of the interviews I did with families, it's really about raising consumer education, raising awareness about parents' options, trying to really promote parent advocacy and leadership so that we can kind of drive the market to support families in a better way.
Heather, thank you so much. And your reports are online, and they're great. So looking forward to everyone reading them. Cindy, how about you?
Yeah, so at the Policy Center, we are advocating and promoting to at least match what the Federal Paid Leave Act is currently enabling federal employees to take, which is 12 weeks of paid leave for both parents. And so at the Policy Center, we really believe at the minimum that should be a national paid leave law.
That makes so much sense. Abby, how about you?
I would say that one of the biggest things that I think we encounter is a misunderstanding or kind of lack of information about some of these programs, and would say that there's a real opportunity for education in this space and for helping people understand that paid family and medical leave programs are really the benefits significantly outweigh the costs, both to our families who are actually taking the leave, to their employers, and then also to states and our broader communities. Like these are good on the whole, and there's a big return on investment.
Absolutely. Emily, what would you say?
Yeah, so I highlighted the powerful community-driven nature of FRCs, but many people outside of the communities don't really know about FRCs, and especially Congress is just starting to learn about what family resources are and the important work that they do, which is why the coalition's work is so vital. The coalition was formed just last year, but we already are making great strides. Last year, we achieved a historic milestone by passing the first ever federal definition for family resource centers under Title 4B, which is huge. So now we have something to reference when we're talking to legislators. So we're really excited for that. If you are interested in supporting the coalition's work, the website is in the app.
Yeah, the website is great resource. So thank you. So we only have a couple minutes left, but I'd love to hear just one takeaway you would give to our audience and those online today about the incredible work that supporting our families is so critical It's a huge question. Yeah, I know.
I think for my program in particular, with unconditional cash, our whole thing is about trusting moms, right? Trusting birthing people, trusting poor moms, trusting Black moms, just trusting moms. And so if I can leave you with anything, I would honestly just say trust moms and trust people to know what they need to get themselves to the next level, and to, meet their family's needs as they know best.
Thank you.
I love that. And I think I'll continue on the topic of trust that comes up so often in the childcare fields about parents leaving their young children in the hands of others. And so just the issue of trust, trusted caregivers, trusted information, just needing more support, especially for new parents that are transitioning in this space.
I think for me, this work in paid leave is so important because it ties together all the different things that we've talked about. And I think it really underscores the constellation of support that mothers need from all different resources. And, when we talk about trusting moms, the moms are saying that they need more support. They need more rest. They cannot heal without that time to recover. So I think that is so important. And to echo what I said earlier about having a national paid leave policy and really supporting moms across the spectrum, physically, mentally, financially, emotionally, so that they can better support their communities, society, and family.
Thank you.
I would echo that and just add like that I think this panel is a great representation of the broader economic and family supports that people need to feel supported in these critical periods and as their families grow. And also that states will have room for opportunities here. I know there's still a lot of, we've talked about the federal context, and the state context also, of course, features a lot of tough decisions ahead, but there is opportunity and more opportunity, I think, than some folks think. So hoping to move that forward.
Wonderful.
Yeah, and I just want to echo everything everyone says, and I think that's why people in states are seeing the need in their communities to develop these centers, family resource centers, because there is so much need for support. And as I said, they are so unique. They provide resources from food assistance, crisis intervention, diapers, anything that parents and families need, really offering a welcome, judgment-free zone that's barrier-free.
Thank you. And this is really an economic issue that can support families in such a critical way that if we all lean in, those 4 Ps, I think this is something we can all consider together. How do we holistically support our families? So thank you all for your great information. And all the reports are available online and websites. So thank you.